Hello, King's A&E. In 10. Thank you. Bye. 10.
King's College Hospital, London. A major trauma centre.
Have you got her blood pressure yet?
She was on the floor and I thought she's dead.
And one of the busiest A&E departments in the world.
Stabbing, code red.
King's is everything. Everything pounds in through that door.
The badge has been trapped between him and the bridge.
A place where love.
Can I wait here until she comes home? Can I come home with her?
Life.
Oh, apart from having a brain injury, never better.
What happened?
I got bitten.
By who?
By me mate.
And loss unfold every single day.
I've not got a happy feeling of you. Not breathing.
All the patients you're about to see were treated in one department, in just one 24-hour period.
You're going to be all right. You know what happens when things are bad? Daddy's here.
Please don't cry.
The moment that you're in resus and you're really sick and all you can think about is, am I going to live, am I going to die? Silly things go out the window. And ultimately what's important is realised that you're loved and that you're not alone.
A litre of normal saline in that side stack, girls. Can I have an arterial blood gas and can we have IV access and bloods taken in the other? I'll have a chest x-ray, a BM and a urine. Will you do me an ECG just in case it's tricyclic? The minute I walked into the emergency department, I knew that I never wanted to escape its walls, that was where I was destined.
Liz has worked at King's for 10 years and will be running resus today.
Pulse rate's about 60 and it's regular. Sir, can you take a deep breath in for me, please? And out. That's lovely, that's fine. Just sit forward for me, sweetheart. Chest appears absolutely clear. Did someone comment on a bruise or something somewhere?
Liz is really, really good. She's particular, but she just likes to make sure that all the I's are dotted and the T's are crossed.
Can you go and find the porters round the corner and say, Liz wants the oxygen changed in cubicle 6, please. As quick as you can, out through those doors, turn left and then round. Can I have the BM machine? Is that there as well? I'm not here to be popular. I do know that members of staff will bring me their children or their relatives, and for that I'm truly grateful because I know I'm a bucket load to handle in resus. I know that the jobs come out of my mouth quicker than people have time to do them. Can I have a chair for Mum, for his wife? That's fine, Mum. I say Mum. It's me doing children all day. I work 1 day a week at the moment because I have 4 children at home, a 5-year-old, a 7-year-old, an 8-year-old and a 9-year-old. And my difficult job, my full-time job, is being a mother of, such young children. I find resus with all its bays full still easier than basically the 4 o'clock till 6:30 session at home when you're trying to get through the school run, tea and homework. Well done, thank you. How long have you two been married? 45 years, well done. I will try my very hardest to get him put back together okay for you.
Kings. Yep. 8 minutes, that's great. Thank you very much. Cheers, bye for now. Paediatric red phone, ETA 8 minutes. That's paediatric red phone, ETA 8 minutes.
Who's dialing 278? Will you do that now? Yeah. Let's get that through to them. Thank you.
9-year-old Tino was found slumped and confused at her desk at school. She's been brought in by her teaching assistant, Lynn.
If we get the patient transferred over, and I'll take handover after that. Hello, sweetheart. Right. Thank you. Nice and loud, please.
Tino fell asleep in class, which is very unusual for her. And when the teacher woke her, she can't remember people's names. She can't follow some simple instructions. She's very, very confused.
Is she complaining of a headache at all?
She said she's got pain all over her head. She can't pinpoint it. No apparent injury. Pupils are reacting, but when I've tried to get to follow the pen torch goes that way and she looks the opposite way. She says she's got a bit of tummy pain, did feel a bit nauseous, but she's soft on palpation and just saying ouch every time I touch her. This is very, very out of character. Our teachers are very concerned. Mum's on her way.
Hello, Tino. Tino, I'm Dr. Hobbs. I'm one of the accident and emergency consultants. Sweetheart, I'm going to examine you now. OK? Can we just shut the curtains, guys? If someone wants to come in, they can. Tino, what's your surname? Do you know your surname, darling? No. Do you know where you are? Do you know where you think you might be?
At home.
You think you're at home? OK, darling, have you got pain?
In my tummy and in my head.
You've got pain in your tummy and in your head. OK, sweetheart. Do you know what day it is today?
Wednesday.
You think it's Wednesday? OK. We're disorientated in time, place and person. Can I have a BM if that's possible, team, as we're quickly... And the paediatric team, can we set about getting IV access? When you get people who are disorientated, they're truly losing their grip on reality, and it means you have to act very quickly to find out what organ system's going wrong and how best you can support it to try and improve it. Doesn't appear to be any neck stiffness because she's up and down voluntarily herself, isn't she? Children are amazing. You can lose them very, very quickly. They hold it together quite well and suddenly they can just boom, gone. And you need to be able to spot the warning signs. Right, I want the use knees chase because of the CRP, etc., etc. I was trying to cover all the potential options for her. They're all life-threatening. Dan, I don't like this.
You've had them all. I never had all of them, mate, 2. You had 3. 3 then. Could you massage my ankle, please? You should have had it looked at before when I told you to. Stop going on. You better have done something to it, making me sit up here again. Otherwise, I'm going to kick you in it, and that will do something to it.
See, this is it. You're going to moan if there's nothing wrong with my ankle. Yeah, I didn't want to come round here, so you're not going to moan.
Excuse me, I was phoned and asked to fetch you up here.
The tummy appears soft, considering there's other things going on. A line, please, as soon as we can.
9-year-old Tino is disorientated and complaining of pains in her head and stomach. She's been given glucose and antibiotics, but the cause remains unknown.
Because I wonder if we need to actually include the abdomen with that as well. There's a sort of a hidden perforated appendix or something like that. She's not pyrexial. Her potassium's up. I'm just getting an ECG. Oh, excellent. Do come in through, madam. I'm Dr.
Her mum, Tracy, has arrived at the hospital.
And that's lovely. Just step back for a moment. Right, I want a proper history from Mum now. Right, so any long-term medical problems with her at all?
She's got explorated.
She ever had any operations in the past before? When did she last eat and drink?
It would have been this morning when she was coming to school.
Does anyone oversee her having breakfast or not?
Yeah,
Does
my sister is there with her at home.
You last saw her, Mother last saw her last night?
I saw her this morning. Well, I slept with her.
Oh, you slept with her? Yeah. OK, fine. So she didn't appear hot or in any way sleeping deeply or anything like that? No. BM's 3.6. OK. You can give another 50 mils then. Tino, who do you think I am? What do you think I might be? Look at me, sweetheart. What could I perhaps be?
The hospital use only?
The hospital? Yes, you are in a hospital. Do you know the job I could do?
Use only?
Tino had an almost disengaged appearance, but I feel she was quite an intelligent child. I felt when I was asking her questions, I could almost see her looking around the environment, trying to pick up visual clues. What about this lady? What do I do? Jana, what does she do?
King's College.
What day is it today, darling?
Danger.
Danger. So her lack of fear made me more concerned that she was more unwell, because the average 9-year-old is not very comfortable in an emergency room. Tino was sort of floating on the top of consciousness, having superficial conversations that might initially appear okay, but when you dug a bit deeper, you could see she wasn't okay at all. Can you see things, Tino?
I can see a map of the world and a globe and a box and a card saying happy birthday.
She ever had any episodes of confusion at all before?
Never. Never. She's always on the
She's normally a bright, intelligent little girl.
Clever.
Articulate.
And at school, yeah, she's quite surprisingly more intelligent than...
Yeah.
I could not just believe it. She was just lying there staring like she was seeing some ghost or something, and it really broke my heart.
You eaten and drunk? You've got to eat and drink, sweetheart, because it's going to be a long haul today. Technically, we've got to think about things like encephalitis. CT are ready.
Liz suspects Tino has encephalitis, a meningitis-like virus which attacks the brain.
We're happy. Yes, thank you, sir. Look. Have that one, have that one. Yeah, shh, come on. Harrison, no. Come on.
you was probably annoying at that age, Al.
Oh, at least it'll put you off having them too young then, wouldn't it?
Yeah.
Got a glove on it.
Get yourself a good job, Al, first.
Mum of 6 Karen is in majors with her daughter Samantha, son Alfie and grandson Harrison. She's experiencing numbness down her left side.
Right, you're probably going to need a scan.
Of what, my leg?
Your head.
Because it's numbness, I suppose that's why they're going to have to do the heads.
Yeah, we just make sure, just to be safe.
Yeah.
Probably nothing, but...
She's brilliant mum. You know, I wouldn't have asked for a better mum. She's brought us up basically on her own, you know? Not having a man figure in our life as a father figure. We didn't have a father figure to help her out in our upbringing. So she's done an amazing job. She has really done an amazing job considering she's done it on her own.
What an MRI?
A CT will be enough.
CT, yeah, because I can't get in them machines.
Oh, they're horrible, aren't they? I had my neck scan once.
I can't.
CT scans are all right. I've had one of them.
Yeah, CT's like a polo mint.
Like a donut, yeah.
Yeah, but it don't come right near your head or anything, does it?
Nah,
It just
fine.
sits
Only
there.
takes a few minutes.
Yeah, seriously, it's all right.
But you'll need one of them, probably.
I do feel that it's my responsibility to take care of my mum. Yeah, and I think that she enjoys the fact of taking advantage of me taking care of her. But yeah, I do. I enjoy it as well.
Them MRIs are a bit too cramped in, though, for my liking, mate. Oh,
Yeah,
God,
I
I
don't
couldn't.
know
I just
whether I'd be
couldn't.
able
It makes that loud noise, doesn't it, which makes you...
I didn't even get halfway in. I'm going to get me a hat, get me a hat. I said I felt like I was in a coffin. I said, go on, Mum, you'll be all right. And the man's pushing me in more and more.
You're like that, in you go.
Yeah, exactly.
I was like, just go in.
How long are you in it for?
Not even 5 minutes, I don't think.
Yeah, it only takes 7 minutes, I think, for a
that's
full scan.
It didn't feel like that for me.
Don't take long. Gloves.
Neurology-wise, these is the best hospital ever. These are the best, the dental and neurological, best hospital ever. It's all brain experts, they are.
Thanks, CT. Well done, sweetheart. Will you phone up the labs for me and tell me I'm very keen to get the blood results quickly? Is that all right? And tell them the story, because they will come with the answer quicker. Yeah?
Been nursing for 20 years. I work late, and I always tell her, Tino, you have to go to bed before I get home. But she won't go before she sees me. And same thing in the morning. When my alarm goes, she wakes up to come and say goodbye, Mom, and then she goes back to sleep. Me and Tino, we have quite a very strong bond. A very strong bond. Tino is a very vibrant, articulate, smart girl, very energetic. She's in ballet, she does swimming, so full of energy, you can't stop her. I love Tino so much, and I was so scared that I was gonna lose her.
Majors.
Hello.
Yeah.
Miss Humphreys, hello. Hello. My name's Samantha, I'm one of the doctors. How are you feeling?
She's Samantha, that's my daughter.
Oh, hi. Excellent name. Right, so why are you here?
Oh, I was coming back from taking them to the shop yesterday evening, and I could feel working from the bottom of my left foot up to my leg, and it was numb.
Okay.
The same with the arm. Like, my arm went weak, but not as bad. I got home, I thought, oh, I'll just ignore it. It might just be something silly.
Yeah.
Gone to bed, I've got up today, and it's still the same.
How many times has this happened before?
I've had it on regular occasions, on and off, on and off.
She's a very anxious with anything, worrier. Like when I was 18, she didn't want me to go on Brighton Pier in case it collapsed, you know, like then even now at 27, when I go out clubbing, she's texting me, are you home yet? And she's always been the same.
Just relax for me. Sorry, it's not very easy to relax, is it? Especially when you're in hospital. You have a doctor telling you, just relax.
It's easier said than done, eh?
Just relax whilst I'm sitting in majors. All right, so close your eyes for me.
It's kind of, I've got used to it now. It's horrible because, you know, if my mum feels ill, I try and talk her out of it. No, you're right, you know, it will pass. It's panic, Mum, you know, stop worrying. But I will sit up in hospital for 7 hours if I have to, in support of my mum.
Arms up like a boxer. Don't let me pull him out.
I visit the doctors on a regular basis. Yeah. Maybe every couple of days.
There we go, just relax your legs.
I feel limited. I feel like I can't go somewhere where I'd like to go, have a good time, just in case I come over feeling ill again. I have to be near where there's a doctor's or a hospital.
Right now, what we need to know is we need to find out what's going on with the left side of your body. And I'll have a chat with the neuro team, see if we can get someone to come down and see you.
Yeah, all right then.
All right.
Yeah.
Do you want the curtains opened or closed?
Leave them open.
Sorry to trouble you, it's Dr. Hobbs phoning, one of the accident and emergency consultants. I'm keen, if it's possible, to have a CRP result back on a little girl, a 9-year-old. And this is because I don't know what's going on with her. Anything, basically, you can give me, I'd be grateful for. She's confused, she's 9. We don't know what's happened to her.
Tino's scans are inconclusive.
Pete, can you just have a look at the X-ray? Because that's an erect chest that's up there, and I just want to check there's no air underneath the diaphragm.
Liz is treating Tino with antivirals. Her priority is to reduce the risk of permanent damage to her brain.
Pam? Nothing there. It looks okay. Can you have a look down her ears, her nose and her throat, please, next? My biggest crime, if I could commit one, is assuming that I've got the diagnosis or I know the diagnosis, and in fact that turns out to be wrong. But in the emergency room, I'm trying to make sure that I've excluded any of the big killers.
You'd be better, Tino.
Encephalitis.
I have to say I'm stumped because...
Confused?
No...
Completely confused. What's completely confused? I don't know is the answer. When you have a child in who is poorly, parents assume that you are trying your best. What you've got to deliver is the results, and time matters for that.
I don't like this cappuccino. I've got to see the Provident woman on Monday. Get along.
This is all numb. All of it. It feels like, do you know, like when you go dentist and inject it? That's what it feels like. It's all numb, that numb.
You know what? It wouldn't be so bad if it was here and here, but it's the eye what I'm concerned about, in case it damages your eyesight as well.
I can see perfect though.
Yeah, now you might be able to, but what happens in a couple of days' time? The minute I looked at it, I knew straight away, hospital. Otherwise you wouldn't have bothered. I want to know what's going on. I am your mum.
Girls, is her temperature up or down or anything? Pardon? So it's slowly climbing. I put down query encephalitis, and I don't know whether she needs a vasculitic screen. I guess she needs an LP under GA. And I'm just, you know, when you sit there and think, what is it with this child? I don't know what the diagnosis is.
What do you remember? Having your cereal. That's it. You don't remember anything after that. Good girl. But you remember me? Do you know me? Tino, look at me. Do you know me? Do you know me? We just want you to know yourself and your date of birth, yeah? Just try and remember that. Yeah, that's what I'm saying. Maybe when you have a sleep, you'll feel better. Yeah, my baby. Oh, love you very much.
I'd like to think I hold it together as well as some of the best parents that I've seen in resus. I would be ashamed to say that I don't think I could match up to some of the stamina and fortitude that I have seen displayed by various relatives, where they get the inner strength to deal with what they have to deal with. I don't know.
They haven't got a diagnosis. That's the problem.
Is she in pain anyway?
She was saying she's got tummy ache. She can't even remember her name or her date of birth.
Where's the other lady?
Which one? We loved and cried.
The one that was wearing the blue short top.
The nurse, the one that was here a minute ago, the Indian looking nurse?
Not one of the nurses.
Doctor?
No.
With the headscarf on?
No.
Mummy?
The one that was standing there with the blue top on.
The blue top on.
No.
She's stripy top.
No. It's her mother.
Oh, okay.
She has gone to look for food.
Yeah.
Yeah.
Where?
Mummy.
It's your mother, Mama, dear.
You know, I expected her to smile and hug me and cry and tell me, you know, what was going on. But she didn't. She just stared at me like a stranger. She just looked at me. I said, Tino, it's Mom. And she, you know, she just kept on looking at me. And at that moment, I just couldn't take it. Because I tried. I said, Tino, it's Mom, I'm here. Tell me, what's wrong? What's the matter? And she just looked straight into my eyes like, who is this woman? What are you talking about? And that just broke me down.
They not work hard in here, you know. They're always on the go, aren't they?
Yeah.
Hi, it's neurology. Hi, this is Sam, one of the EDSHs. I have a lady down here. She has a left-sided sensory loss. It's well, it's marginally acute, as in basically it comes and goes. It's been intermittent now for a few years.
Losing my granddad, I think, was a massive, massive turnaround for my mum in her life. My mum being the youngest of 13, she was literally the baby who'd be with her mum and dad every single day. He was more or less like her rock, so losing him, it kind of made her life literally just head south.
The GP are getting on my nerves now. They keep, because she has anxiety and depression, they're just putting it all down to that.
Down to that all the time.
Yeah, then they'll send her home. Oh, don't worry about it, you know, it's your anxiety. And now, I've come with her today because it's getting on my nerves, so I'll be there to support her next time they tell her it's anxiety. I know, I'm 26 and I've been with my mum all her life. Do you know what I mean? So for her,
and I'm not
when
stupid.
she rang me,
I know the difference between the feelings.
Why did she decline it?
Yeah, it must be difficult, and I'm not excusing what anybody said, and I don't think anyone's labelling everything as anxiety and depression, but you can imagine we see a lot of patients that become even more anxious about the smallest things when they do suffer from... But if this has happened so many times before and now it's not going away, then we do need to investigate this properly. Have you had a CT before?
Not, I'll tolerate a CT.
Have you had a CT?
No, never.
Right, CT scan we're going to do today, and that's not going to show as much detail. That will show us if you've got an acute bleed.
Life's not the same without him. Never.
What was special about him, Karen?
Everything. Everything. There for me. Whenever I needed to speak about when I didn't feel well, he'd be there, tell me what to do. Well, what she was saying, she said go have a scan.
What?
Scan in my head.
Yeah, but then that will give you a peace of mind, though.
And what if they find something?
Well, if they find something, they find something. What can you do about it?
It's hard. It's very hard without him. I wish he was here. Sounds selfish because he suffered, he was so ill. So you don't get nothing on your head or anything when you're going for a CT scan?
No. It doesn't touch your head. It just sits around your head.
You don't feel like you can't breathe?
No. It's not a tunnel or nothing.
I just can't. I'll never get over him. Never. I know I've got my kids and my grandkids, but I'll never get over losing him. Say if he's seen anything on there. He'll have to, won't he? Is it all right? My heart's going boom, 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 boom. I think I'm panicking because I'm working myself up. Because I'm thinking, oh my God, something's wrong, something's wrong, something's wrong. Calm down.
So, yeah, so it's good news. Yeah, there's nothing wrong. I can't see anything obviously
So we head
abnormal
back.
there.
Thanks very much. Take care. Have a nice evening.
Bye.
GPs have said to me, you do get physical symptoms, but it's not a physical cause. It's psychological, it's mental health problems. But to me, it's physical, and it's a medical problem, I believe. They've told me I have got an illness, and it is severe health anxiety. That is what's wrong with me, but I don't accept it. He said the CT was clear, and he said he's going to write to the GP and get me in the MRI open scanner. We've been up here since 9:30 this morning. You know?
I watched this thing.
Haven't you had a lovely day?
Yeah, but to be honest, I think you've gone a bit further, and you've seen a neurologist now, which is the important thing.
That. Thank you.
At least you got away
I've been
with having an
investigated.
MRI anyway.
Yeah. Thank you so much.
Yeah, you've been a big help.
See
Thank
ya.
you very much.
Thanks.
Take care.
such a bloody mummy's boy. You are. Oh, well. When you're not well, you want me.
3 people in front of me. 3? Yeah. I don't think there was 3 people in front of me when we came in. They got to fix it.
Ouch. That's tight.
Yeah. We need to keep him still until we've done the X-rays. So he's doing really well. He's cold, yeah.
He looks cold.
Yeah. We'll get him warm.
11-year-old Bailey is in with his mum Leslie and sister Kay.
I can't believe it's happened. No, me neither.
He's been hit by a slow-moving car on his way home from school.
Should have seen how quick I jumped out of the bath and got dressed. I was dripping. Oh, bless. Flung myself down the stairs. Silly cow.
I think you've broken your leg.
Yeah, so do I.
Yeah? I almost certainly have. But the X-rays will obviously confirm that, but by the looks of it, for sure.
Of all days, it had to be a Thursday. That's what I mean. Any other day, I would have been with him. Yeah. Now I feel awful because I weren't there.
So as soon as we've done the X-rays...
Did I make that happen? Did I make that beeping happen? No, that's me.
Let's get the X-rays done.
How much oxygen was he on? Yeah, no worries. I'm just going to cover you up again. Make you decent, yeah.
This is a very nice hospital.
Oh, all right.
Very nice stuff.
Oh, thanks. Hope you're including me in that.
All right.
When I was in the hospital bed, the person I wanted to see the most was my mum.
He's bored. So bored.
She's very nice all the time, and she hardly ever shouts.
I spy my little eye, something starting to see.
Curtain.
Ceiling.
Oh, God. Should have guessed that, really, because he's all he can see, isn't it? My little ginger ninja.
Don't you dare say that.
Oh, it's all going off in here, isn't it?
I'm a radiographer. I'm going to take quite a few X-rays for you, if that's all right.
Oh, you're doing the X-rays here?
Yeah.
Oh, is it right back on that side?
Oh, yeah, no problem.
Is that all right?
Do you not want to be,
Well, they're only doing X-rays and I'll come back in a minute. I need to have a cigarette. Yes, love. I love you too, darling. Don't, because you'll make me cry. You're all right.
Me?
Okay,
no,
I like
not a
you
word.
too.
I love you too. What a living. You'll be all right. Don't worry. It's only your leg. I know it's scary. Do you want me to stay here with you, or do you want me to go for a fact? You want me to stay?
Hey, you can go smoke it if you want. It's alright.
Do you want me to go or stay?
Oh, you do what
No, it's up to you.
No, you do whatever you want. I hate when people say that. It's up to you.
They don't have to step out when I take the X-rays, so they don't get irradiated.
So I need to go anyway, so I'll be
They don't want
outside.
X-rays as well.
All right, so I'll be back in a minute. You all right, Mum? Yeah, I don't want you to worry, but Bailey's had an accident. He got knocked over. Don't really know, Mum. He just said he was crossing the road and a car pulled out and he didn't see the car, so he's probably just run across the road. I said, what's the chance of me bringing him home? And they said no. But I have to go and get him some pyjamas and stuff. He just made me cry because he said he loved me. So, love you too. Bye.
warm in this hospital, isn't it?
It is.
Tell Alia on 424 she is to refer this patient to a paediatric neurologist because she needs an EEG and she needs further investigation, and we mustn't stop until we've got an answer.
Once I get out of here, I know what I'm doing first.
What's that?
Having a nice hot bath.
You won't be able to.
Oh, why?
You have to stick your cask out.
Oh, crap.
How are you going to get in? It's not like you to want a bath. I've got his stuff I might be able to bring him home. I bought a tracksuit.
It's Bailey, isn't it?
Yep, Bailey.
Right. So you've got quite a nasty fracture
Yep.
of the bone, of your thigh bone, and that requires an operation.
I'll do it.
But what we need to do firstly is we can get this splint off, but what we need to do is put a different type of traction on it
Okay.
to pull the fracture out.
Ouch.
Okay? It might be a bit sore when we're doing it, but I'll be as quick and gentle as I can. Right, so you pop one of those on. If it's too painful, then let me know and we can stop.
It'll only hurt for a bit and then the pain will go away.
Well, not to swear.
No, don't swear.
You're all right.
You're not even 12 yet.
Not even 12, you can't swear in front of your mum.
Do you feel the legs like fizzle sticks?
Crikey O'Reilly. All right, all right.
You're all right.
Alrighty.
All right, go on. Good boy, well done.
Alrighty,
All right, well
righty,
done,
righty,
well
righty,
done.
righty, righty.
Okay, good.
Well done, you're doing really well. All right.
Monkey on the stick.
Yeah, keep going like that. Monkey on a stick's good.
Ooh, fudge cake.
That's it, yep. That's better.
Ooh, peanut bar.
Yep.
Sorry, I know, Bailey. Just try your best to relax.
All right, all right.
Try your best to relax for me. It's all right.
Don't tense up.
I think this is kind of being sexist, I think, in a way. But, like, men aren't supposed to cry, I think. And women are. I'm not sure about that, but I think that's what it is.
Try and do what they do when you're in labour. Not that you're in labour, but breathe. What is it? You breathe in through your nose, isn't it, and out through your mouth?
No, I didn't do it.
Yeah, breathe in through your. Oh, mind you, I don't know whether you can. Try and breathe in through your nose, and then out through your mouth. That's it.
Yeah, blow the pain away.
That's it. To have grown men crying doing this, babe.
I've had grown men crying for
Yeah, I can imagine. Yeah, I can imagine. I certainly would be.
Yeah, you're a trooper.
Yeah.
An absolute trooper.
In through your nose. They've nearly finished. The last little bit now. In through your nose and out through your mouth.
That's it, perfect.
Good, well done. You did so well.
Good, fine. And then we'll get you upstairs to one of the wards.
Okay, where the beds are?
Yeah.
Yay.
Something a bit more comfortable than the trolley.
I hate my life.
I just want to be happy. I need to go and get some help. To go and speak to somebody and tell somebody how my day's been, or if I've got problems on my shoulders that I can't share with anyone else. that I need to speak to somebody about. That's what I need.
I have learnt that you should never cross the road where there is not a crossing and look both ways. Twice.
Some things came back quickly and some things came back slow. My friends and my family's name were the first things that came back to my mind.
When you do my job, you go home at night and you cuddle your children and you hug your husband and you're grateful that they are fit, alive, are well and there. You learn what the real priorities are and the fact that it can be gone so quickly that actually I find that coming to work makes me a better mum.
An assault could be a tiny graze or nothing wrong, or an assault could be someone that's been beaten up, kicked, stamped upon and stabbed.
Do you have any funny feelings in your arms or your legs at the moment?
Just feel really weak.
Whereabouts? Just all over?
My arms, my legs.
When they said they were going to take Sam to King's, he wanted to go somewhere else. He just didn't want to remember what happened there.
Thank you.